Hi, I'm Dr. Nemechek of the Nemechek Protocol. I want to talk to you about dealing with autistic kids, um, developmental delay, the therapies, and maybe some ideas on how to manage things as the kids are recovering. Now, so I want to say, all you parents, you're doing a marvelous job. Um, the persistence and tenacity and the love that you're showing and your ability to kind of hang in there through probably some almost completely intolerable moments is really, all I can say, I've got tons of respect for you. Okay. And I've had a lot of discussions with parents about, my kid is doing so much better now. One, do these therapies, OT or PT, and the sensory therapies and just all the kind of stuff that you've been doing to get these incremental gains out of your kids. How necessary are they? Are they harmful or things like that? Now, as you know, I talk about I don't like supplements. I don't like probiotics. I like stripping everything down just to the core parts of the protocol. The exclusion is prescription medicines. Your kid has seizures or something like that. You got to keep them on those drugs, okay? But we like to pare things down. But the therapies are not harmful. They do not seem to get in the way of our recovery. In fact, they help improve the pruning that gives us the developmental process and so forth. So they're very, very important in that respect. But what do we do with these therapies once your child's really recovering significantly? And I think you get to a point where we've got to start just taking the training wheels off and let these kids develop on their own. Because, for instance, I'm fortunate I didn't have autism or developmental delay, any of this stuff when I was young. But my kind of OTPT equivalent, the thing that drove me to prune my brain in the correct way, was me just interacting with the world. Was me wanting to be like that kid over there at the park, or run like him, or behave like him, or follow my teacher's instructions and write this way, okay? And just I want you to remember that's a very powerful stimuli. So if your child's getting to be able to function and eat and use utensils and use a pencil and a keyboard and interact with children at the park, I think it starts to get a time where we start getting rid of some of this therapy. We've run across a few children now in their teens who have experienced a lifetime of somebody calculating and measuring and monitoring every kind of aspect of their life. Now, I understand where that came from, and those therapies help to get them to where they are, the functional level they had achieved. And so I'm not discounting that. But these children at times strike me as very insecure about what is right or wrong. And it's a very complicated thing, but I think part of it is that they've had so much monitoring that they need to gain a sense of just confidence, okay? And I think you get that without the monitoring, you don't have to log all the poops. You don't have to, just get rid of all the spreadsheets and the data and the therapy sessions. As your kid starts recovering, just get them to interact with the world. Now, that being said, if they're doing really well, the sensory problems are gone and all that kind of stuff, but they still have trouble writing, you need some therapy to help them get to write. Okay, so I'm not saying you throw everything overboard. I'm saying you just start looking at what you really need, to help them to get to this functional state, a refined state. And the other stuff you got to get rid of, because we now have to work on their self-assurance. We want them to feel like any other kid in the classroom or any other family member at the dinner table. That's why I try to start getting rid of all the food restrictions, or any other kid at the park. All right, because they're going to be molding their self-esteem, and that's as critical as being able to write correctly. All right, so just start thinking about that a little bit, about when you ought to start getting rid of some of the training wheels, so to speak, that we're doing when we're seeing all this fantastic recovery that's occurring. So just a little thought from me today, and I hope you all have a nice weekend. This is Dr. Nemechek, Nemechek Autonomic Medicine, Buckeye, Arizona. Take care now. Bye.